So you've had a lumbar fusion, a lower back fusion, and you think that you're out of the hole, and I'm here to tell you and give you a heads up. So stay tuned. Hey, this is Dr. Shaki from Irvine Spine and Wellness Center, your Irvine Posture and Movement Clinic. A lot of times people come to my practice with surgery, and many times they're about to get surgery and they're wondering if they actually need to do so. What I'm surprised to hear is when people come in with lower back surgery fusion and they're told by their doctor that there are no limitations, they don't need to worry about anything. And here I am telling you that is a total nonsense. If we take away movement within a joint, we cannot expect to make zero changes in the segments above and below. So if you have a lower spine, in this case, for the sake of this video, we're concentrating on lower spine. If you're having a lower spine fusion, then certain movements are taken away. And it's so important to make sure that the segments above and below are functioning and moving properly. You don't want to go and start weightlifting. You don't want to go and start running necessarily, because weightlifting is very easily done wrong, and running is basically jarring your joints, which is not a smart thing to do. Not that I'm saying don't run and I'm against runners. I actually used to run myself, but that's not the point here. What needs to happen is functional movement exercises, movements that babies do specifically without any bands or dumbbells or kettlebell or anything like that, that will allow strengthening of the surrounding tissues and movement of the surrounding joints, which is super important because that lack of movement in that fused area leads to lack of movement in the surrounding joints, and basically an extension of the problem beyond the area of surgery. Huge thing to consider, and do not go with things that make zero sense. It does not make sense to assume with a fusion you don't have any other restrictions and you don't need to worry about anything else. One of the first things that's going to be compromised is your pelvic floor in the form of pelvic floor dysfunction. If you have no idea what that is, we're going to make sure we put a link that explains what pelvic floor dysfunction is. If you're wondering if you have pelvic floor dysfunction, or if you have had fusion in the spine and you're wondering how that's impacted the rest of your body, and you want to make an appointment, please do so. Subscribe to the channel, and you're more than welcome to follow us on Instagram for daily exercises that we post. Thanks for watching. Take care.